there, I'm Shannon Connolly, a family doctor and associate medical director at Planned Parenthood of Orange and San Bernardino counties. So, sexually transmitted infections. Ever heard of them? Well, you're about to hear a lot more because it is STI Awareness Month. There's a lot of stigma surrounding sexually transmitted infections, but in fact, they are really common. 1 in 2 sexually active people will have an STI by the age of 25. To help break down some of that stigma, I'm going to answer a few questions. Let's get right to it. More or less, historically the term STD, or sexually transmitted disease, was used a little bit more commonly. More recently, medical professionals have switched to using STI, or sexually transmitted infection, because it's considered a little bit more accurate and perhaps doesn't cause as much stigma. It depends on the STI and the type of sex you're having. If you're not having any symptoms, your healthcare provider might offer blood or urine testing or a swab of your throat, vagina, or rectum. If you are having symptoms, in addition to those things, you might also get a physical exam and some additional swabs as well. Sexually active people should get tested regularly, even if you don't have any symptoms at all. The CDC has specific guidelines for how frequently you should get tested based on things like your age and your sexual behaviors. If you're not sure, I recommend that you see a trusted healthcare provider who can help you figure out what your risk is and how frequently you should get tested. As a general rule of thumb, though, the more sexual partners you have, the more frequently you should get tested. Practicing safer sex, of course. Using condoms can help prevent you from getting or transmitting sexually transmitted infections. It's also really important to get tested regularly. Finally, I recommend that you have really good and open conversations with your partner. It's important that you know whether they've gotten tested and what their risk factors are. I know it can be a little bit difficult sometimes to start those conversations, but ultimately having those conversations builds honesty and openness in a relationship, and hopefully will bring you and your partner closer together. Thanks for taking a little bit of time to learn more about STIs. If you'd like more information, or if you'd like to make an appointment to get tested, visit the link in our bio. Stay safe out there and be sure to practice safer sex by using condoms. Dr. C signing off until next time. Bye.